Your patient needs lipid-lowering therapy. You bring up a statin. They immediately say, "Nope, last time I couldn't walk." Now you're stuck between guidelines and lived experience.
So let's talk about what to do when statins are off the table. Let's talk about the CLEAR Outcomes trial.
Statin intolerance is one of the most frustrating problems in primary care. Depending on the cohort, 7 to 29% of patients report muscle symptoms. Whether every case is true myopathy is debatable, but clinically it does not matter. They are not taking the drug. Enter bempedoic acid. Mechanistically, this is not just another lipid pill. It inhibits ATP citrate lyase, which sits upstream of HMG-CoA reductase in the cholesterol synthesis pathway.
So you're still suppressing hepatic cholesterol production, but here's the elegant part.
It is a prodrug that gets activated primarily in the liver, not in skeletal muscle. So in theory, you get LDL lowering without bathing muscle tissue in the active drug, which is exactly the problem patients complain about.
So in theory, it should work, but where's the evidence? Well, the CLEAR Outcome trials enrolled nearly 14,000 patients who were unable or unwilling to take statins.
This was not a soft primary prevention population. 70% were secondary prevention with prior cardiovascular events. Mean age was 65. About 46% had diabetes. Baseline LDL was 139. This is your real-world, high-risk clinic population. The follow-up was 3.5 years. LDL measured at 6 months showed a 21% drop in the bempedoic acid group compared to placebo. More importantly, bempedoic acid reduced the risk of the primary composite outcome by 13% relative to placebo. Break that down, and it gets more interesting. Fatal or non-fatal MI dropped by 23%. Coronary revascularization dropped by 19%.
But now you knew there was going to be a catch. There was no significant reduction in overall mortality or cardiovascular death.
And because it alters renal transport, you see slightly higher rates of hyperuricemia and gout, about 3.1% versus 2.1%. Cholelithiasis was also higher, 2.2 versus 1.2%. But here is the detail your patient cares about. Myalgia rates were essentially identical between drug and placebo.
So what does this mean Monday morning? Well, the trial used 180 milligrams orally once a day.
This is not a statin replacement for everyone, but for the truly statin intolerant, it gives you a mechanistically distinct, outcome-supported option. Here's what to monitor. Check baseline uric acid. Check renal function. Be cautious in patients with active gout or significant gallstone history.
So here's the bottom line. Statin-intolerant patients are not out of options. Bempedoic acid lowers LDL and reduces major cardiovascular events. And it does this without increasing myopathy. Are you prescribing this yet, or are prior authorizations holding it up? Let us know.